following put this patient at the highest risk for this diagnosis. There's a 6-year-old boy, primary care provider, for his adoptive parents he's been brought. 3-month history of jaw swelling, travel history of recent immigration from Equatorial Africa. Mother is deceased but was HIV positive. There's extensive lymph node swelling on the left side of his jaw. There is no ulcer. There's also an ulcer that appears to be infected, and a fine needle biopsy shows a diagnosis of Burkitt's lymphoma. Right? We want to know what is the highest risk that caused it. So Burkitt's lymphoma, which translocation? It's 814. Okay. So make sure I just go through all the translocations. There is Burkitt's lymphoma. Then you need to know AML type 3. Then of course our favorite Philadelphia syndrome. Then there is follicular lymphoma that you need to know. Then you need to know in case of mantle cell lymphoma also. Okay, so just need know those translocations. In this case, it is 814. And basically, all of these lymphomas involve some kind of translocations that includes the IgG gene. Okay. So there are two types of Burkitt lymphomas. There is a endemic form. There's a sporadic form. Endemic form is associated with those who belong to Africa or have spent most of the time in Africa. What theory suggests is that there is an interaction between P. falciparum and EBV. So any child who is born would be infected with EBV, would remain asymptomatic for a long time. And then there are multiple exposures to P. falciparum because of the prolonged stay in Africa. And this recurrent exposures, it is not just P. falciparum per se, but it is the recurrent exposures and its interactions with EBV that leads to Burkitt's lymphoma. And this endemic form is more common in the age groups of 4 to 7, and it presents with jaw swelling or the jaw lymph nodes being more affected. Okay. The ulcer here is just because of the compressive attitude of the cancer, which has split the skin and led to an ulcer, and that is of course more prone to infection. So that is not something we need to pay attention on. Another form of Burkitt's lymphoma, that is a sporadic form that can occur in those not endemic to Africa, and it is seen in relatively elder children, which presents with ileocecal or abdominal or pelvic involvement. Okay, so this case, it is jaw swelling. It is obviously because of endemic Burkitt's lymphoma. Okay. Infected ulcer, so there's nothing to do with it. Gender has nothing to do. Ethnicity has nothing to do. It is the exposure of that particular area. And close family member with HIV would not be an answer in this case. Of course, HIV patients are more likely to be infected with EBV, but this patient does not have any other symptoms or signs of HIV. Right? He's 6-year-old. He is bound to have multiple diseases because of immunocompromise, but none of those are present. So this patient does not have an HIV picture. Okay. Yeah. So why does EBV cause Burkitt's lymphoma? Is that it is hypothesized that EBV causes immortalization of lymphoid cells. So these B lymphoid cells, they cannot go undergo apoptosis. There is an anti-apoptotic effect of EBV, and that leads to proliferation of those cells. What is the histological picture that you will see in Burkitt's lymphoma? What is the buzzword? Starry sky appearance. Yes. And how are the macrophages? Tangible. Right. Correct. Okay. Well done. Okay. So you want to talk about buzzwords and histology. Wait. Can you repeat the last sentence? Yeah. For the Burkitt's lymphoma, what is the buzzword that what is this very specific term that you use for the histology of Burkitt's lymphoma? That was what I was asking, which is starry sky appearance. Okay, so I guess we are done.
Thanks for watching. Please give a thumbs up and subscribe for more.